Good morning, everybody. Dr. Anita here from Milan Family Chiropractic Center. You're riding in the car with the Chiro right here in Bayville, New Jersey. So this morning I wanted to talk about patients who actually have to have surgery. It's a difficult decision to make, not only for the patient, but it's a difficult decision for me as a chiropractor to have to acknowledge that that needs to be done. There's things called limitation of matter. And what that means is this: when somebody comes in and they have old injuries, we do our best to keep them, good morning, Aggie, to keep them from having to go under the knife. However, there are times where we don't really have a choice. While we will do our best from a conservative perspective in hopes that we can avoid a patient from having to have surgical intervention, there are times where that conservative approach just isn't enough. And so I recently have had 2 patients in the last week and a half that are going to have surgery. And I can go for quite a few years and nobody has to have that done. And then all of a sudden, there's a couple, and I have another guy who's considering it. Thanks, Aggie. I have another guy who's actually having to consider it. So what makes me as a chiropractor consider surgical intervention for my people? Well, one of the things is when we do a regimen of chiropractic care and we attempt to do as much correction as is possible, sometimes the symptomatology that the patient presents with doesn't go away. Or worse yet, it can actually get worse. In one of the 2 cases, the symptomatology has been getting progressively worse. We certainly sent them out for further diagnostics, MRIs, orthopedic consults, and then surgical consults. Not one, but multiple surgical consults to make sure that we're getting the right opinion for this patient so that they can get what's done. And there's a majority of us that are in agreement. And so the one gentleman unfortunately had failed back surgery syndrome, where he had surgical intervention in his lower back and wasn't able to walk after that surgical intervention. So he hobbled into my office quite a few years ago with the hopes that he could walk. Well, we completely turned his life around with chiropractic conservative care, and he was out walking 2 miles a day. However, the damages and ravages of time throughout his spine showed up, and he started having some other issues in his arms and to his hands, where we attempted another intensive conservative approach, and he started losing grip strength. At that point, it's like we need MRIs. We need surgical consults, and the end result is he's having surgery next week to decompress the spinal cord, which is absolutely necessary. And he had 3 surgical consults before he made the decision. Hard decision for him and his wife, especially after having failed back surgery syndrome. But it's the appropriate decision for this gentleman because it absolutely needs to be done, because his quality of life, he likes to tinker and work on cars, and he can't even hold a nut or a bolt in his fingertips. So it's time. But here's the caveat. Post-surgically, we need to manage his spine so that the areas above and below that surgical area do not fail, and so that he never has to undergo the knife again. And so there is value to surgical intervention with some folks. Always, I'm going to say to you, try a conservative approach. If you haven't tried chiropractic with whatever pain or numbness or tingling that you have, you must at least give it a try with a corrective care chiropractor. What does that mean? Because I'm different than other chiropractors. I'm not a pain relief chiropractor. What that means is we design a care plan that is absolutely perfect for you, for us to do the most correction possible. I say the most correction possible because sometimes the ravages of time and trauma in your life has limitations as to what I can or can't do. If you've got severe degenerative arthritis, there's only so much correction that can occur. I'm never going to correct your spine completely because there's arthritis. That was the case in this gentleman's spine, obviously. So with that being said, if you or someone you know, someone you love is suffering with numbness, tingling, having difficulty picking things up or walking, they're losing their strength, at least try chiropractic first before you have a surgical consult. Or if you've already had a surgical consult and you have an MRI, bring it to us. Let us look at it and let us determine what's the best course of action conservatively before you dive into surgery, because there's no coming back from surgery. At least try a conservative approach. So with that being said, this is Dr. Anita from Mylon Family Chiropractic Center right here in Bayville. You've been riding in the car with the chiro, and we're talking about why surgery is necessary at times. And we will care for you before surgery, up to the date of surgery, and then we will care for you post-surgically, because the best thing we can do is maintain the correction that was done surgically so that you never have to undergo the knife again. So I hope you have a great and glorious weekend. The weather's going to be fabulous. I intend on enjoying it as well. I'll see you on the next ride.